Okay, so in this video, we're going to start obtaining your vendors. So that's what we're going to talk about. Again, you're going to need vendors to get started, regardless of what you're doing. You're going to need medication, you're going to need supplies. And so that's what we'll talk about today. As we hop in here, we'll be talking about what vendors you actually need, what vendors will ask you for, how to order and contract the smart way, and then how to protect yourself from disruptions. So share this course. Let's help more MPs and RNs build freedom through ownership. You get a bonus of 40% commission when you share your invite link with them. And if they buy anything from us in the future, warning there, this is the most important video in the entire course. You're going to want to have vendors. You need those to get set up. You want to know exactly what you need to give them in order to get set up, as well as if you have any disruptions, how to handle those. So pro tip here, watch the video in 1.75x speed. That'll only help you get through the video faster and start launching your clinic even quicker. So overview here. At this point, you're locking in the vendors that allow your clinic to function. Your vendors supply your medications, your supplies, and your lab support. You do not need every vendor on day one. And the goal here is reliability, not perfection. So vendors you will typically need. So the core vendor categories are going to be your medication vendors. They may include compounding pharmacies for weight loss, hormones, or vitamins, right? There are also other type of medication vendors, but these are kind of the big ones for the wellness clinic services that you'll likely offer. Also supply vendors for things like IV supplies, injection supplies, and clinical equipment. And then lab partners support any type of diagnostics or monitoring when required. So for instance, if you're doing weight loss and if you're doing hormones, you're going to need labs in a lot of cases. So it's completely up to you if you want to do those in-house or not. And by in-house, I don't necessarily mean doing the full test in-house, even though in some cases you may want to do that. But what I do mean by that is you may decide to draw the blood here, spin it in the centrifuge, and have someone like LabCorp or Quest to come pick it up. So in any of those cases, you'll need a lab partner. But in the most, I guess, relaxed case, you may at least want to point them to a nearby lab partner, whether they are one of the big box labs or if they're like a personal, more family owned or small business lab, where you can get some specialized pricing around sending people to them. So again, in either case, you want to have some lab partners for those kind of services. Also, additional vendors may include aesthetic suppliers or insurance providers. So what vendors will ask you for? So typically vendors will require your business name, EIN, and your location. Clinical vendors may require medical director information. So especially if you are a non-clinician or you're a registered nurse operating this kind of business, they will typically need your medical director information. And so you'll want to have that on hand when you go about applying for the vendors. Vendors will require billing and patient information to activate your account. Typically, everything is going to be digital with your vendors. They're not going to be sending you an invoice in the mail or anything like that. And so you're going to want to have your your payment and billing information on file so they can bill you. Now, granted, in some cases, especially if you're doing telehealth, you may enter in the patient's billing information into the vendor, and the vendor may charge the patient directly. In most cases, I wouldn't advise you to do it that way. What I typically have them do is bill us, the clinic, and then the patient will just pay us when it's anything where we're bundling in like a consultation also with the medication itself. So for example, with something like semaglutide, whether we ship it to them or not, they're going to be billing, the client is going to be paying us, and then we're going to pay for the medication, regardless if we're shipping it to them or not. Almost all vendors operate through online portals for ordering and account management. So again, they will have an online portal for you. That's exactly what you want to get set up in. That's exactly what the application process is all about. Once you get your username and password to the portal, you can then begin to navigate those and then start ordering medication and supplies. So next here is how to order and contract the right way. So start by ordering small quantities to test quality and reliability. I cannot urge you on this enough. So when we started our wellness clinic, for starters, we did a big order of semaglutide, and no kidding. It was on the truck for about 3 days because FedEx kept coming when our clinic wasn't opening. And because of that, it would just put the medication back on the truck. If you know anything about semaglutide, it has to be kept cold. So we literally lost $2,000 within the first unofficial day of opening, really, because we hadn't even opened yet. And so that's why I always recommend that you start with very small quantities and test the quality of it, but also the reliability of it and also the shipping of it. So you have a sense of what's the turnaround time is on shipping. When do your delivery drivers tend to show up? Because most of your medications will need to be kept cold. And if they are on the truck all day, then if you live in Texas, for sure, the efficacy of the medication will drop tremendously, and you may not be able to give those to your patients. So keep that in mind. Start with small quantities, and as you build up some understanding and trust around the vendor itself, then you can start to grow your quantity that you are ordering. So do not sign long-term contracts during the launch phase. So most of these vendors that we've talked about so far, there's no sort of long-term contract of any kind. But in any case that you are doing some other services that require you to contract with someone long-term, I would err on the side of not doing so if you have the option. I'm really bringing this up for people who, again, are doing services that are not as typical. I do have some clients who want to do some things that I would say are outside of the general parameters of a wellness clinic. They may just be adding wellness services, or they want to do some more cutting edge, innovative things. And so with some of those suppliers, they may have long-term contracts where you get incentives or special prices. But again, those can also come with some requirements that may be not as advantageous for you if you're starting. So again, I always bring this up. I don't see it applying across the board, but keep that in mind. Early orders are about learning, improving demand, right? So that's why I want you to be reactive instead of proactive when it comes to ordering. Early on, obviously, you want to have some stuff on hand for patients that are coming in, but as you are starting to see patients, don't feel the need to go stock up for a month or 2 months or even 2 weeks sometimes. Sometimes you may only want to stock up week to week. This keeps your costs low in the form of supplies. And a lot of things like vitamins, for instance, they do expire, and they can expire sometimes every 30 days. And so I don't want you to be ordering a whole bunch of supplies and medication and the demand isn't there for it yet. That don't mean that doesn't mean the demand will not come eventually, but you want to be reactive to the demand, not proactive. So you can increase volume once your patient flow is consistent and you have a really good sense around how many people are going to be coming in. Now you can save yourself a lot of time by ordering more, so you may only be making 1 or 2 orders a month. But at the beginning, be reactive. That may mean that you're ordering more frequently, but because we've done these small quantities, we understand, the quality and the reliability as far as the medication getting to you, as well as using the medication. We can time in our head, okay, I know that semaglutide takes about 2 days to get to me. So at day 3, I see I'm running low. I'm going to go ahead and make an order. But again, it's still going to be a small order. And it's not going to hold me for a whole month or even for 3 weeks, because I know that this comes in 2 days. So I always have that window that I can align with. And so these are the type of thinking that you can use in order to launch lean, keep your costs low, and that your revenue can be a lot quicker when it comes to getting to your bottom line. So build in backup and redundancy. So always identify backup vendors for critical medications and supplies. Shipping delays and supply interruptions happen more often than people expect. And having a backup plan prevents canceled appointments, lost revenue, protects your clinic and your patients. So I want to go back to that slide. So let me say this. Unfortunately, bad things do happen. So for example, there was a hurricane, I believe, in Florida. This was last year or early this year, I believe. And so what happened was IV bags were in short supply, because unbeknownst to us, a lot of IV bags are made and manufactured in Florida. And so due to that, for people like McKesson, IV bags were on consignment, I believe it's called. And so due to that, we were unable to order, multiple boxes of IVs because, as you know, hospitals are ordering those all across the country. And so because of that, us being a small business clinic, we were not getting preferential treatment around that, but we were still seeing IV patients. And so you want to have a backup vendor. So we use McKesson predominantly for our IV bags, but you want to have a backup vendor in order to make sure if anything like that happens, you can still get what you need in order to serve your patients. I give you another example. So again, these are all very unfortunate situations and lives were lost in these situations. So I'm not making light of them whatsoever. But as a business owner, you do have to be aware that these things can happen. So a plane crashed, a UPS plane crashed, and typically our GLP-1 vendor uses UPS in order to ship medication. Well, when the UPS plane crashed, because we are still pre-reactive to our patient volume, we were not able to get our medication as fast as we typically would. UPS grounded everyone, not only their planes, but even their drivers in reaction to that horrible event. And so we need to go use our backup GLP-1 vendor so we can make sure that we were getting medication in during that time or that 2 to 3 day delay that came with what happened with UPS. So again, that's just another example of something that is completely out of your control, albeit very horrible, that can disrupt your clinic. And what you have to understand is, especially with something like a GLP-1, people are going to be coming in daily to stay on their schedule to receive their injection because you want to receive it typically the same day, if not a day before or a day after you typically need to receive it. And so if you are disrupted and for whatever reason they have to wait a few days for the medication, that's not going to build out a great patient experience. You're not going to get the revenue you need. And then for some patients, they may even be so frustrated about it, especially if it happens often, that they may go to another clinic. So again, you want to protect your clinic, you want to protect your patients because again, that's a safety part around patient care, as well as a revenue part for you in your reputation. So again, you want backups. This is really not optional. I always recommend it. Now, granted, as I said earlier, you don't necessarily have to do all this stuff at once, all at one time. But again, I want you to be aware of it and be thinking about it as you scale and grow your clinic. So some key takeaways here: secure only the vendors required for your core launch services. Start small, stay flexible, and avoid long-term commitments early on. Backup vendors are not optional in healthcare, so we got to get those. And if you enjoyed this course, make sure you let us know, right? I always want to make these things better. And the only way I can do that is from hearing from you. And so please let me know if you enjoyed this course, if you got a lot of value out of it. That would make me so happy to hear. And again, if you didn't, let me know where I can help you. So if you do need help, book a call with me. If you want to move faster and avoid costly mistakes, this is a great way to do so. We help with entity setup, compliance, medical director matching, legal and clinical documents, EMRs, marketing, and so much more. And also around vendors, if we do work with you, you will get our full list of vendors, the vendors that we use in our clinic right now here today. And so if you are interested in that, definitely schedule a call with us. Again, there's no pressure on those calls. So when you have that call with us, we'll go over where you are now, where you're looking to go, and then we'll provide you with some practical steps that you can take in order to get there. And so, book a call with me. I would love to talk with you. I love to help you. And so I'll see you soon on the next video.